Polycystic Ovarian Syndrome, or PCOS, is a very common whole-body metabolic condition affecting women's hormones. The presenting signs and symptoms include hirsutism, with excess hair on the body and face, irregular cycles, acne, difficulty in losing weight, and insulin resistance. There are multiple underlying causes. Thus, it is very important to evaluate each client carefully to ascertain where the issues lie. It is important to carry out comprehensive testing. We can carry out blood tests to look at hormone levels, metabolic health, and general physical markers. We can also arrange Dutch testing to look at the urinary metabolites of testosterone and androgens, which can be raised in PCOS, and see whether the patient has estrogen dominance. A pelvic scan can also be helpful to assess the presence of multiple cysts or follicles, which are a typical feature of the condition. We can then make a personalised treatment plan and use a functional medicine approach and bioidentical hormone treatments to produce the best possible outcome for the patient.